Good afternoon to all of you who have come out today. We, the MNA nurses and healthcare professionals of the Cambridge Health Alliance, are here to ring the alarm and bring to light the conditions that we believe threaten the safety of our patients, our staff, and families as we fight every hour to respond to this unprecedented and deadly epidemic or pandemic. Speaking publicly in this way was not our first choice. For nearly 30 years, my entire nursing career, I have been a nurse at CHA. And like the nurses here on the lawn, those caring for our community in the hospital behind me, those at the hospital in Everett, at the urgent care center in Somerville, and in clinics throughout Cambridge, Somerville, Everett, Revere, and Malden, we take great pride in the Cambridge Health Alliance. We believe in the mission of CHA. We just want to make our contributions to assuring that our system lives up to that mission. We did not ask to be in this position. We asked repeatedly over the past weeks to be heard, but were met continually with excuses and temporizing. We came to understand that we had no acceptable choice. The issues we are raising today have been brought forth in any number of meetings and through written and verbal communications all along the CHA chain of command. When effective solutions to our serious safety concerns were not forthcoming, we took the step of mobilizing our members to action. Over a period of just a few weeks, more than 72% of nurses and healthcare professionals that we represent in these facilities put their names to a petition outlining in clear terms our key grievances. This mandate was achieved even as our colleagues have been scattered, redeployed, sidelined at home, and worked countless hours of overtime in the service of the CHA mission, our mission to the community. Last week, a delegation of CHA nurses delivered the petition to our senior management. The petition stated, in part, "We have worked and continue to work under conditions of tremendous challenge and adversity. Severe staffing deficits in the context of heightened patient acuity, core equipment shortages, and turbulent changes in policy and procedure. We continue to risk exposure to COVID-19 on every single shift, but we're there, providing the care that is needed. Countless informally documented exposures have occurred, even under faithful adherence to an evolving PPE policy and the ill-advised mask reuse program. Internal testing and contact tracing interventions remain insufficient, and we lack access to affordable alternate housing and childcare for the protection of our loved ones." You can find the full text of the petition on the MNA website. We hoped the overwhelming demonstration of support from the Frontline staff would be enough to convince the administration to listen to us. We expected the CEO, Dr. Saya, to meet with his colleagues, the nurses and healthcare professionals he purports to lead at the Cambridge Health Alliance. But no, he rejected our overtures twice in the last week. We did get a response from Dr. Saya's underlings, managers and administrators who have served as apologists for the status quo and who have also failed to include us as active partners in the real suggestions and solutions to our serious problems. Their response has been an unequivocal rejection of every one of the demands made in the petition for respectful and fair treatment of essential workers. Just yesterday afternoon, the Vice President of Human Resources again communicated Dr. Saya's refusal to meet with us. We take this refusal to even meet as a personal and professional insult to each one of us, and a clear signal that the person who has been entrusted with the very lives of patients and staff of this organization, has no interest in hearing and learning from those on the front lines. We who are at the bedside and bear the greatest risk from the policies he and his subordinates continue to foist upon us are not worth even a discussion from our leader. Last evening, as chairs and representatives were on a call working on a response to a last-ditch effort made by our local legislators to broker a meeting in exchange for cancellation of this press conference, Dr. Saya and his minions were making plans to preempt that meeting with a CNO town hall. Lack of transparency and failed trust have been an issue with this administration for some time now, and it is our experience that this behavior is continuing. We as nurses hold a sacred trust and obligation under our licenses and professional codes of ethics to work on behalf of our patients, our community, and ourselves. We are our community. Our ultimate responsibility is not to our employer, it is always to our patients. In recognition of our duty to the public, we are here today to alert you to our concerns for our safety due to the inability of our administration to provide us with what we need to keep you safe. Our safety is your safety, and your safety is ours. Our patients' lives, our own lives, and the lives of our loved ones have been put at risk by the lack of access to appropriate personal protective equipment. This organization is complicit in the largest scale violation of occupational health and safety standards in history during a pandemic that requires the highest standard possible to protect our community and ourselves. This CEO and his administration make excuses and refuse to meet with us while more and more of our coworkers and patients are exposed to this virus. For weeks, the nurses have documented the ongoing lack of proper personnel protective equipment, including having to reuse N95 masks that have been treated by an unproven decontamination process, lack of foot and head coverings, and early on in the pandemic, the lack of clean gowns, which forced nurses on one unit to experiment with trash bags as protective covering. None of us are safe, and CHA is not doing its job to keep us safe. At least 152 CHA caregivers, 20% of our workforce, have tested positive for COVID-19. In the most recent discussion with the Nurses Union about the rates of workplace infections, CHA claimed that 0% of employee infections were workplace acquired. This is similar to the stance taken by the Commonwealth, where employers are skirting responsibilities for workers' compensation claims and future liability by asserting that worker infections are community acquired. Nurses working directly with COVID-positive patients were infected at the grocery store? This position is disingenuous and reprehensible. Every day, our dedicated nurses, CNAs, technicians, physicians, therapists, administrative clerks, interpreters, housekeepers, food service workers, and so many more, those of us who make these hospitals and health centers run, walk into these places ready to do what is necessary to take care of you. But we do so in fear for your safety and our own, because we know we do not have the PPE, the staffing, the equipment, and the testing we need to do this job. And we are not alone. Nurses from across the state, from Pittsfield to Cape Cod, are raising similar concerns. Our professional association, the Massachusetts Nurses Association, of which I am a proud member on the board of directors, is doing all we can on the state and federal level to address this crisis. We are here today, and we are doing our part to educate and to advocate, and to say, not on our watch. I will call upon Jillian Brailsford, a former member on the MNA board of directors, a nurse who has worked on our busy COVID-19 floor since the beginning of this pandemic. Jillian is here to present a first-hand account of what CHA nurses have been facing. Jillian?
Can you hear me? I'm going to talk loud. My name is Jillian Brailsford, and I'm a registered nurse. I work on the 4 West unit here at Cambridge Hospital, a medical surgical unit that has been converted to provide care specifically to COVID patients. I have been working at the bedside approximately 50 hours per week, caring for fragile, terrified, isolated patients who are struggling to breathe. We've come together as a phenomenal team on my unit and throughout this system to bring the best we have to offer to the crisis and to our patients. And we're here today to celebrate that and to bring our story to the public, because our request to meet with our CEO to discuss pressing health and safety concerns has been denied. When this crisis began, we, the registered nurses of Cambridge Health Alliance, asked our employer for a full, transparent PPE supply count so we could participate meaningfully in the conversation about how to use those supplies. We were denied that opportunity. Here is what happened instead. We were forced to provide COVID care on my unit without N95 respirator protection. People were reprimanded for wearing N95s and directly instructed by managers to remove them. We were denied the option of wearing self-supplied equipment. There were days when my coworkers cried together in private locations. We worked per active hospital policy in dirty disposable gowns shared between multiple caregivers. Our safety was so compromised on my unit, we figured out how to make backup gowns out of trash bags. We continue to work in visibly soiled masks, which are recycled for multiple uses, and substandard masks with straps that regularly break. As Susan said, we are living and working through the largest scale erosion of occupational health and safety standards in healthcare history. And we're here to talk about what we've learned so far, because this pandemic isn't over. And it's our duty to our patients and to Cambridge Health Alliance and to each other to ensure that the voice of our profession is heard and no opportunities are missed going forward. Many of the patients we've been caring for are essential workers just like us. We're caring for warehouse workers, construction workers, grocery store workers, transportation workers, and healthcare workers who risked COVID exposure to go to work for their communities, just as we are doing. CHA essential workers are the community. There is no clean divide between us and our patients when it comes to these matters of health and safety. This is why the petition we have advanced includes all on-site essential workers in its demands, from housekeeping to dietary to public safety, because we really get what it means to say we're all in this together. In the past several weeks, when we report to work, we've been participating in mandatory temperature screenings with faulty thermometers that routinely report temperatures of 93 or 94 degrees. Why do essential workers care about this? Why not just check our temperatures at home? Well, we do, and we're not complaining for the fun of it. When your employer assesses your temperature at 93 degrees and wants you to work anyway, the message is loud and clear. Healthcare workers' safety is a smoke and mirrors game at this point, and if we don't insist on telling the truth about it, no one else will. CHA cannot remain complicit in the industry-wide fiction that healthcare workers have been sufficiently protected during the pandemic, because we have not. This is a mission-driven public organization with a contract with the public and a duty to tell the truth. And CHA can do better than that. We need CHA to lead with us. Thank you.
Thanks, Jillian. Autumn St. Hilaire works also on the COVID floor. She will now talk about our concerns for the lack of appropriate equipment to care for our patients.
Good afternoon. My name is Autumn St. Hilaire, and I'm a nurse on our COVID-19 telemetry unit here at CHA Cambridge Hospital. While I'm still early in my nursing career, I never could have imagined what we are now facing. From the beginning of this pandemic, my colleagues and I have felt uneasy due to our administration's changing guidelines and protocols and the frustration in watching so many of the most pressing issues on the COVID unit fail to be addressed. It started with the ever-changing requirements for PPE. In the beginning, nurses who were wearing masks were ordered to take them off in the hallways and other areas, despite the risk that posed to the public and ourselves, so as to not raise alarm. It seems as if with many of the issues we're facing, there's been more of an emphasis on image than safety. While improvements have been made, such as the provision of Tyvek suits for protection, which we appreciate, we're still required to reuse masks multiple times, a practice that before the pandemic never would have been allowed. It's not just issues with PPE that have nurses concerned, but also the lack of proper monitoring of COVID patients, particularly the availability of telemetry monitors with alarm systems to monitor and alert nurses to sudden changes in the patient's oxygen levels, which is crucial to preventing these patients from experiencing rapid respiratory failure. One of the reasons why this monitoring is so important is because the doors to patient rooms on our COVID unit are shut at all times in order to prevent the spread of the disease. The problem with this is that the majority of the doors are not outfitted with windows. We are no longer able to set eyes on a patient when walking by their room because the door is closed. There are no words to describe the guilt I've felt when I open one of these doors to find a patient suffering in respiratory distress who is too sick and lethargic to call for help. My 32-bed unit has only 16 of these appropriate monitors. It's not unusual for a patient to be taken off this continuous monitor in order to accommodate an admission from the emergency room, only to be placed back on the monitor the next day when one becomes available, because they were not stable enough to come off in the first place. As an alternative, the hospital has implemented a plan where baby monitors are used, which are monitored remotely by staff to check on the patient's oxygen levels. This is not a safe system, and we can't understand why we don't have the appropriate monitoring and proper alarms for every patient. The public comes to us expecting that we have all the tools that we need to save their lives, whether it be PPE or monitoring equipment, and right now we don't. These experiences and concerns are unique to bedside nurses, which is why we have fought to have a meeting with our CEO so that he has a true picture of what is truly happening on our unit. It is very likely that we could experience a second surge, which is why we should take advantage of this opportunity to listen to the nurses who are sacrificing the most and make better decisions to fulfill our mission of protecting the public that trusts us. Thank you.
Noreen McAlinden is a nurse, on our adult psychiatry unit. She will talk to us about the conditions the patients and the nurses and the staff taking care of those patients are experiencing in the area of psychiatry.
KO4, where I work, is the locked psychiatric unit. Many of the patients are there involuntarily. It has served the Cambridge community well, I think, for many, many years. Many of our patients consider us to be family. The nursing staff, most of whom have worked on the unit also for many years, feel the same way. We love them and know their families and their community. It is a very small unit. It's a unit that does not allow any form of distancing per CDC guidelines when it is at full capacity. We are concerned that in some cases treatment there might pose more risk than the disease. The nurses are concerned that they are unable to keep their patients safe. We can't enforce the guidelines of social distancing. We mostly can't convince many of them to wear masks. The beds on the floor are glued to the floor. Patients share a few common spaces and 3 small bathrooms. Our census has been consistently at 18. We think the census should be dropped. We prefer, if possible, for those most vulnerable to have their own rooms. We want families to know that we, with business as usual, regretfully cannot guarantee keeping their loved ones safe according to established guidelines. Because we're running at full census, we are running with full staffing as well, which complicates social distancing among staff in a very small nursing station with limited ventilation, and this further increases the risk to everyone on the unit.
So we've heard from several of our nurses. You've heard our main demands. We do have something we want to say to the nurses who are gathered here. This is a first step. There will be many more to follow. Your representatives will be meeting on Saturday, distantly of course, by Zoom, as we meet every Saturday. But we will be meeting to discuss the next steps, what we will do now, what our best actions are. And so we urge you to be alert for that and to talk to your reps, to be ready to move and get to work. We are not finished. We have just begun. So this concludes our formal remarks for today. We are here for questions, interviews, or any media requests. Thank you all for being here, especially the nurses and staff of CHA who have given so much and of whom so much has been needed. You are my heart, you are our heroes, and you are our future. Thank you.